First question, what originally brought you to our office?
So my wife found you guys, and she really liked the place. So she kind of gave me a recommendation. So that's when I decided to come here and start.
You have to
Looking
take your
into it.
wife's advice. That's the best way to go. Do you know where she found us?
I don't know if it was Google, because I think when she needs to get dental work done, she would rather be knocked out for some things.
Mm-hmm.
And you guys do that here, obviously. And it seemed like a good fit for her, so she recommended me to come here.
I'm trying to remember. Did you? I can't remember if you had did you have a sense of the scope of what you needed or were interested in to come in, or was it just hey, I want to clean my teeth and keep things healthy? I can't remember exactly where you started.
Yeah, I didn't like the way they looked, and I was really self-conscious about it. So I got an estimate to see what it was and went from there.
Mm-hmm. Had you done that with anybody else
Nope.
up to that point? Okay. And then was it were you? I'm curious. Were you already kind of thinking about that?
Yeah, because the position I'm in now, with what I do, I have to do a lot of public speaking.
Okay.
So I didn't want people staring at my
Sure.
ugly teeth.
Oh, yeah. So you had and then it's Tiffany, right?
Yeah,
And
Tiffany.
then Tiffany came. Were you already maybe pursuing it even before Tiffany came, or was that?
No.
Okay.
She kind of pushed me.
Right on.
That leads right into my next two questions. How were you feeling about your smile before starting treatment?
I didn't smile.
We hear
Very
that.
self-conscious about it.
Did you have any fears or concerns or hesitations before coming to the dentist? I think it had been a while since you'd seen a dentist.
Yeah, only what people that were looking at my teeth would think.
Mm.
Yeah, I'm just kind of afraid of what.
Yeah, because I was so self-conscious about it, and obviously people that work in a dentist's office have nice teeth, and I didn't, so I'm like, I hope they're not judging me.
No, no.
What was your first impression of the office and our team?
I liked it. They're, very nice, very informative. It seemed to me like it'd be a good fit for me, so that's why I decided to pursue here.
Oh, we're glad you did. Was there any certain ways that the team helped you feel comfortable throughout the process?
Yeah, Dr. Weber, always asking, are you all right? Are you good? And it, with the pain or whatever, was going on at that time.
I think you're really good to a lot of patients say at explaining step by step when you're in a procedure.
I think part of it is just I'm a nerd, and I like talking about it. You wouldn't believe what I'm doing right now. I think for us, I think there's a certain level of lightheartedness that professionals might be tempted to do from a flippant standpoint of maybe they're not taking it as seriously as they need to. But then I think there's another side of lightheartedness where it's we love what we do so much, and we do feel confident in what we're doing that it frees up that aspect. And I remember I think a few situations where we were just
Right.
laughing, and sometimes I walk away, I'm like, gosh, did I take it too lightly? I was like, I wonder what he felt.
No,
like.
and we would
It's
joke
fun,
around and stuff,
yeah.
Yeah, it was good.
Good. I always felt self-conscious that
No.
you didn't even Sandy. Wasn't even taking it seriously.
Were there any moments that you felt especially cared for or supported?
Yeah, when I had problems with my temporaries or something and had to hurry up and call and run back in here, you guys accommodated me.
Yeah, absolutely. It's part. That's part of it. I think it's tough, especially bigger cases. It's tough to navigate. We want them to be retrievable, right? So that it's not too difficult to move to the final. But sometimes they're too retrievable, and you were super gracious about it too. That always makes it easier.
Yep.
How do you feel that your smile or your overall health has changed since finishing treatment?
I love my smile. A lot more confident talking in front of people now. and they're not zeroing in on my teeth that are messed up.
Do you do a lot of public speaking
Yeah.
now?
Yes.
Does it make you feel more confident? I've heard that from
Yeah.
people that would
Yeah.
like to maybe advocate more.
Yeah.
And then they just feel
A lot more confident.
good. That you kind of just answered, but we'll still ask. How do you feel now compared to before?
I feel great. I don't have to worry about, well, I mean, I have to still worry about caring for my teeth, but it's a lot easier now. You know, it's just upkeep.
Have you noticed any changes in your confidence and your daily comfort or your lifestyle?
Yeah, I'm a lot more confident. Yeah. I smile a lot more.
When you came in, I can't remember if you had much like discomfort to start with, or is it mainly aesthetic concerns?
Yeah, I didn't have any like pain or anything, but I mean, I knew at some point if I didn't pursue this, then I would end up with that.
Yeah.
This is a hard one. If you had to describe your experience in one word or phrase, what would it be?
Great. The experience is great.
What would you tell someone who's maybe nervous about getting dental work done or a little maybe ashamed, as like you were?
Don't worry about it. Just go do it. You'll be happy with the end, you know, the end product.
Like when you were thinking about getting started, was there was it finally just like, yeah, okay, it's time, or like were there moments where it was like, I'm not ready yet, or like did you have much hesitation like prior to? Okay.
No.
Okay.
I figured my wife said go get this done. That way they'll start smiling in pictures and stuff, and I'm like, let's just do it.
Cool. Has she been happy?
Yeah.
Cool.
Yep.
Does she notice a difference with you think?
Yeah.
Would you recommend our office or team to others, and why?
Absolutely. This office is very accommodating, you know, and the staff was always great. You know, the appointments, you might sit there 5 minutes and boom, you're in. So there's not a lot of waiting around time when you come for your appointments. And I've done a lot of appointments here.
Was there anything that surprised you about your experience?
Yeah, I guess like from the start, like not knowing what this is gonna look like to the end product that I received, you know, and I'm like, wow. I'm like, Dr. Weber's knows what he's doing, man.
How's that make you feel?
Great. Yeah. No, I mean I do like it's there's a sense in which like I'm really confident in what I do. And like I know like we'll talk about it sometimes where it's like sometimes we can get so focused on like what I'm doing with my hands or like the actual task, and sometimes that doesn't always translate super well to like the patient's experience or like how the patient's interpreting what is happening.
Right.
Because I think sometimes we try so hard to like make it about our thing and what we're doing. But there's just a whole lot of this that inherently takes courage from the patient, no matter how good we are, no matter how comfortable we can make it. There's just a part of the process that is inherently like difficult and takes patience and takes courage. And so like when a patient goes through it like joyfully and is happy with, you know, the end result, like that's there's like for us there's nothing better than that.
Because I remember a day I spent almost 8 hours in here, I think.
Oh man.
And you were like, I still got time. Do you want me to keep going? I'm like, yeah, go. Just do it. You know?
It takes a lot of trust. I mean, you
Right.
really do have to meet each other as strangers and then trust
Yeah.
each other. You have to trust that, you know, you're going to show up and that you're going to be receptive and do what you need to do. And you have to trust Dr. Weber that he's going to take care of you and you'll like the final result. And it's asking a lot of both of you.
Yeah, for sure.
I couldn't be happier though.
That's awesome. That means the world to us.
Do you have any favorite memory or funny moment from your visits?
Yeah, I do actually. A couple, I think. So when he was trying to get the cap off the left side for my implant, it was really tight. Or actually, let me back up. So I'm brushing my teeth one morning, and the right side cap came off. And I'm like running late. I'm like, oh man. I'm like, I got to get this back in. Well, when you're trying to put one of them caps back on, you're in your own mouth, your hands in the way, you can't see anything. So you're kind of just feeling around. I ended up getting it back on, no big deal. And then I was in here for another appointment, and I asked Dr. Weber, I'm like, hey, maybe can you tighten them up a little more? So he did. So when I came to get the implants, this one was really tight on the left. And I'm like, I asked him, I said, man, who tightened that? He said, some jackass.
Man, yeah.
And then we both laughed. I was like, that was a great response.
That makes it a little bit easier to sit there, doesn't
Yeah.
Sometimes you want to go back in time and slap yourself around.
it? When your case was totally finished, what was the first thing you did?
I was taking pictures of myself, sending them to people, you know.
Right on.
Yeah, it was, I think I got out to my truck and I was doing that actually before I left.
Is there anything that you couldn't wait to eat? We had some patients who treat themselves with something
No,
that they
not
might
really.
enjoy eating. Not the
Not
case
really.
for you? Just selfies?
Yeah.
Did you get a selfie stick now?
No, I kind of got long arms, so I can pull it off.
Are you taking more pictures with your wife now?
Yeah, yes. Yep,
I bet she loves that.
yeah.
You guys have been through so much together now.
It's a special bond, yeah. So yeah, again, we're super grateful for the trust and grateful for you coming in here and
Yeah.
being willing to do this. So
Yeah.
appreciate it.
I appreciate it.
Yeah. Thanks,
All right,
sir.
man. Yeah.